Once you have a certain amount of tests, and we started with, 100 tests a day, and then we got up, you're right, to 10,000 tests a day. I think it was by the by the start of April, and then I set that 100,000 tests a day target to make sure we had a lot.
Yes,
right.
I know, but this was the key moment.
Yeah,
this was the key moment when you had to make the choice.
Right.
Well, let me just ask: did care home operators warn your department right at the start of the pandemic not to discharge hospital patients into care homes without a test? Did they warn you of that?
We didn't have enough tests available to be able to do that without removing tests from other people for whom they were a life-saving matter.
But do you acknowledge you were warned of that?
I don't have recollection of that.
OK, well, the Care Provider Alliance, this is important, they emailed you directly. They didn't email your department, they emailed you directly. And they said all people discharged from hospital to social care settings must be tested before discharge.
But the thing is...
So did you get that email or not?
The thing is that in a situation like a pandemic, right, where you have a limited capacity for testing, and we needed a bigger capacity, and we were building that bigger capacity, you've then got to decide, OK, how do we use these tests?
Yes.
And you've got to, as the politician in that environment, you've got to follow the clinical advice on what use of tests is most likely to save lives. And then I'll come back to the social care point, because this is really important. There has been an analysis done of how the virus was most likely to get into care homes. And the proportion of infections that got in from discharges, according to the evidence, is around 2%. Because actually, people who work in care homes live in the community.
Look, I've heard you make that claim before, Matt. Let me just pick you up on it. This is important. Well, I know what you say the facts are.
Well,
do you know? No. I've got it here.
It's the 2021. What I say the facts are. It's just the published facts.
It's a 2021 Public Health England report, right? That's where it comes from. But that data has been dismissed by care operators because they point out that only some people were being tested. So it's actually impossible to know. Take Vic Rayner, Chief Executive of the National Care Forum, that says the data behind that analysis was fundamentally flawed. And there are others who say that you're actually trying to rewrite an element of history to suit a current narrative.
On the contrary, what I'm trying to do here, and this is really important... And actually,
but how could you know if they weren't tested? You must understand that point.
So, hence, that analysis was done by testing samples and trying to find what the best estimate of the truth, and get to the bottom of what are the facts.
Okay.
And this is one of the reasons I've come on the programme. I think it's really important that we learn these lessons. Number one lesson is have and maintain a big testing capacity, right?
Absolutely.
We didn't have that when I was in the hot seat, but hopefully next time, that will be there and ready. But we've got to get to the evidence-based facts in order to learn the right lessons. Because actually, there's another big...
What happened in care homes was incredibly important, and so
I know,
far...
and so I was about to... actually, there's a really big other thing that happened that doesn't get this sort of scrutiny in that space, which is that over the summer of 2020, we put in place a rule to say staff shouldn't move from one care home to another. Actually, that is the thing that is credited by the analysis as making sure that we had much, much better performance, frankly, in care homes.